Cytotoxic drug reconstitution. What is cytotoxic drug reconstitution? It is a process of diluting a concentrated drug into a certain volume of solution for the usage in chemotherapy. It is also a hazardous drug.
Make sure to wear a proper PPE and apply aseptic technique before entering the clean room. There are 4 routes of exposure: inhalation, skin, needle prick injury, and accidental ingestion.
These are the clean room layout, which consists of gowning room, CDR preparation room, storage receiving and distribution room, management and document control room, component room, and changing room. Make sure to wash your hand using the 7 steps technique of hand washing and wear only dedicated gowns, which are sterile gown and non-sterile gown. Clean room grading and PPE. Grade A and Grade B room allows sterile PPE. Grade C room allow sterile and non-sterile PPE, while Grade D room allow inner garments. Post-production activities for product consist of labeling, packing, storage, and dispensing. Cleaning of clean room and equipment. All the equipments and floors should be cleaned after each working session. Disposal of waste. Throw all the used shop consumables such as needles into shop bin and dispose the first layer of glove before exiting the CDR preparation room. Throw all the consumables into a clinical waste bag.
Hi, I will be sharing my experience in CDR. Okay, let's get started. For your information, due to some issues at HSA, Hospital Sultanah Aminah, we need to go to the HSI, Hospital Sultan Ismail, in order to work on our CDR medications. So here's the layout of the CDR clean room. Our workflow is, before we enter the clean room, we will do some preparations on medications and equipments. And when we're done with the preparation, we will put them into the pass box. That pass box are connected with the preparation room inside the clean room. Now, let's enter the clean room. When we enter the changing room, we will quickly change into our PPE. Firstly, we will wear our shoe cover. Next is face mask, and then cap, non-sterile gown, and then glove. But before we wear our glove, we will wash our hands using the 7-step hand washing techniques. Here are the techniques. After we are done washing our hands, we will start wearing our glove safely. We will then enter into the preparation room. Inside the preparation room, we will help with swabbing the medications and equipments using 70% alcohol to sterilize. We also do some checking on the labels to make sure that the patient and the medications are correct. This needs to be done before we pass the medications and equipment into the CDR preparation room. When we are finished with all the preparations, we will put all the medications and equipments that we prepared into the pass box. These pass boxes are connected into the CDR preparation room. As trainees or intern students, our job scopes are limited. We help with preparations such as swabbing and checking in the preparation rooms. We also help top up the equipments that are going to be used by the staff before they enter the CDR preparation rooms. We also help with preparing the CDR medications after they are reconstituted. When pharmacists inside the CDR preparation room finish their works, they will put the medications back into the pass box to us. Then, we will take the complete medications in the pass box back into the preparation rooms. We will recheck the medications to see if there is any leaking at the bottles. If there's any leaking at the bottle, we will put the medications back into the pass box so that the pharmacist inside the CDR preparation room can fix the leaking. We will also recheck the labels whether they are labeled correctly by checking the patient's name, dates, the disease, and the drug names. As students, we are not allowed to enter into the CDR preparation room, but we still get to see the pharmacist in actions. Before they enter the CDR preparation room, they will firstly enter the gowning room to suit up.
Suit up.
Inside the gowning room, they will begin the gowning process to get ready to enter into the CDR preparation room. Firstly, they will wear surgical masks, booties, and then jumpsuit, and then another booties. Next, they will wear the blue colored chemo glove, and then they will also wear the N95 mask. After that, they will wear the chemo gown. Finally, surgical glove. Now, they are ready to get into the CDR preparation room and do their work. All this gowning process is extremely needed and important to protect them from the cytotoxic drug. As we all know, too much exposure to CDR drug could lead to many serious complications. That's all from me. Let me show you some of the pictures and video at CDR.
Interesting facts. Cytotoxic drug reconstitution (CDR). CDR is the reconstitution of cytotoxic drug doses aseptically to final product volume needed with diluents for the administration in chemotherapy. In Johor, Hospital Sultanah Aminah (HSAJB) is the main hospital that responsible for hematology cases. We mainly conduct analysis and prepare medication for hematology patients in cytotoxic drug reconstitution department, while for another oncology cases will be held by Hospital Sultan Ismail HSI. It takes 2 to 5 hours to prepare all the medication ordered. Basically, the duration is depends on person in charge, skills, and total of patients. CDR require more skills during compounding than TPN. This is because there is a chance of spillage to be happen. All of the pass box and doors in CDR is controlled by a lock system. A lock system is involving two sides of door by only having one side of door to be open at a time. It helps to prevent losing any air between the inside and the outside.
Thus, in CDR unit, remove any accessory or personal item from your pocket. Always wash your hand before and after entering the room. Minimize your movement when working in the room. Always stay sterile at all times when working in the room. Make sure you clean after finish your work before leaving the room. Don't in CDR unit. Don't touch anything other than what you're working on. Avoid wearing any makeup when entering the room. Any unauthorized personnel cannot enter the room without permission. Don't bring any personal item into the room. Avoid making any sudden movement when working in the room.
In conclusion, cytotoxic drug is utilized in malignant diseases. These substances may pose occupational hazard. There is rising concern over handling, preparation, administration, and disposal of cytotoxic drugs. Now, let's move to safe handling cytotoxic guidelines. Firstly, identification and safety. Cytotoxic drugs and their risk should be appropriately marked with the capital symbol C and the word cytotoxic under it. Second, spill kit. A spill kit should be put to the place where cytotoxic drugs are processed, transported, handled, and administered. Third, purchasing cytotoxic drugs. Pharmacists should include in the tender contract vendors for the procurement of cytotoxic drugs, which include safe handling measures such as secure containers or small receptacles to minimize the amount of possible spills. Fourth, continuing medical education program. All personnel dealing with cytotoxic drugs should be supplied with initial and continuing hospital-approved education, such as education for safe handling and spill or leak control. Then, it should be recorded. Last but not least, staff safety. The possible reproductive risk of cytotoxic drugs should be well identified to all employees.